Hi, my name is Sarah Wiseman. This is my final head to toe check off. So I have a 42-year-old male here that is 5'8" and weighs 174 pounds. He looks appropriate. He's dressed appropriate for his age, normal affect, and doesn't look like he's in any acute distress. All right. I don't see any lesions or anything like that on his scalp. His hair is well distributed. I didn't see any type of lumps, bumps, bruises, or anything like that. Okay. Let me look at your ears. So I didn't notice any lesions or anything like that on his ears. Okay. Let's see. He has everything looks symmetrical on his face. I'm not noticing any extra facial movements or anything like that. Any type of abnormal sign that there would be something else going on. All right, can you smile for me? Raise your eyebrows, puff your cheeks, show me your teeth. So by him doing that, that shows me that cranial nerve 7 is intact. All right, can you clench your teeth? Clench your teeth. Okay, open your mouth for me. Close it. Open. Close it. Okay, so when I palpated his temporomandible joint, I didn't notice any like clicks or noises, and he was able to clench his teeth, so that tells me that cranial nerve 5 is intact. All right. 3. Pupil size is 6. Okay. All right, look at this object. Okay, look past me. And then look at this object. Okay, so pupils are equal round reacting to light accommodation, and he was also able, or the consensual light reflex, sorry. All right, the next thing I need to do is we're gonna do visual acuity. All right, so I need you to hold this card out, arm's length, and read the smallest line you can. But cover one eye, please.
CFDHJ.
Okay, close the other eye.
LTFDH.
Okay, and then both.
LTFDH.
Okay, so in uncorrected vision, he is 20/20 in both. He was 20/25 in his right, and he was 20/20 in his left. Okay, now the next thing I'm going to do is, I've already looked for symmetry on your ears. Let me do my otoscope. His tympanic membrane is pearly gray. I didn't see any perforations or any type of redness. Cone of light is present. Same thing on the right ear. Didn't notice it. The tympanic membrane is pearly gray. Cone of light is present. All right. Now we're gonna do test and let me know if you hear it, okay? Close your eyes. What yours?
Right. Left.
So, I did the finger rub test on him instead of the whisper test, and he passed that. All right, the next thing I want to do is my tune fork. Okay. Both ears?
Yes.
Okay. All right. Tell me when it stops.
Stop. 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 Stop.
Okay, so air conduction was greater than bone conduction, which is a normal and expected finding. Okay. All right, the next thing I want to do is I'm going to, I need you to close your eyes, and I'm going to tell, or you need to tell me where you feel this at on your face, okay?
The hairline, left side.
Yep.
Right cheek. Left cheek.
So his sensory was intact. Feel your lymph nodes here. Tell me if you feel any tenderness. What do I feel? Any tenderness? Okay. I didn't feel any fixed or immovable lymph nodes when I felt around him, and he didn't say that he had any type of tenderness when I was palpating. Okay. Trachea is midline. Need you to look up. I'm just gonna feel your thyroid here. Okay, can you swallow for me? Okay. All right. So I felt his thyroid. It was soft. I didn't feel any nodules or anything. And whenever he did swallow, that tells me that cranial nerve is intact. Cranial, I want to say 10. Might be wrong. Anyways, okay. So I need you to look to the right for me. Look to the left. Have your chin touch your chest. Okay. Can you shrug your shoulders against resistance? There you go. All right. So he was able to shrug his shoulders against resistance, so that tells me that cranial nerve 11 is intact. All right. His nose is symmetrical with his face. I'm not noticing any lesions or anything like that. Mucosa is pink and moist. I didn't notice any swelling in his turbinates. Okay, can you do me a favor? Can you occlude one nostril and breathe in? Okay, other one? Perfect. All right, so I need you to close your eyes. And close your eyes. And tell me what you smell. Okay. Okay. So he was able to define those or distinguish those two smells, so that tells me that cranial nerve 1 is intact. All right. Open your mouth for me. Hold on. Say ah. Okay. You feel it is midline, and he was able to say ah. So that tells me that cranial nerve 9 is intact. Okay. Let's see. I'm not going to do the gag reflex on him because he has a very sensitive gag reflex, but his tonsils were a grade 1. They were still within the actual spaces that they should be. Need you to stick your tongue out for me. Okay, can you stick it side to side? Okay, tongue in your cheek against resistance. Right here. Okay, so he was able to do that. So that tells me that cranial nerve 12 is intact. All right, so I need you to take off your sandals for me. And let's see. Radial and pedal pulses were both +2. They are strong, regular rate and rhythm. All right, now this is where if you do a apical radial pulse, you need 2 people, one at the radial, one at the apical, to listen for 60 seconds in order to see if there was an apical or a pulse deficit, and that shows that there was inefficient heart contractions, but there's not 2 of us, so can't do that. All right, listen to your carotid. Pulses are 2+ consistent. I didn't hear any thrill, or I didn't feel for a thrill, and and I didn't hear any bruise when I auscultated with the stethoscope. All right, let me see your fingers. Can you take your socks off? Or you want that?
Mm-hmm.
Sure. There we go. Capillary refill on the fingers and toes is less than 3 seconds. Can you take off your shirt for me, please?
Mm-hmm. Sit in.
Alright. Now I'm walking around the patient. I'm not noticing any jugular venous dissension. I did notice any edema on his arms or his legs whenever I was doing his fetal pulses. And I'm not seeing any type of increased work of breathing, any retraction, use of accessory muscles. So he's not showing me that he's in any type of acute distress. I'm gonna count your respiratory rate right here. Just breathe normal for me. I counted 16 respirations. Normal respirations is 12 to 20, so his respiratory rate was within normal limits. Okay, let me see. I'm listening to him. I'm not hearing any type of like audible wheezes without my stethoscope, but I'm going to listen to him now. So listening to his breath sounds as well as his heart sounds, I could hear the S1, S2. That was noted. I didn't hear any gallops or murmurs or anything like that. His breath sounds are clear, and all the lung fields. I'm looking at his AP diameter. When I look at his AP diameter, I'm not noticing any changes anteriorly or posteriorly. Okay, what I need you to do is I need you to say 99.
99.
Okay.
99.
Okay, so when I looked at him for tactile firmness, I didn't hear any type of decreased sound when I did that. Alright. I'm gonna have you go ahead and lay down for me. Head here, feet here. Okay. Alright, so when I look at his abdomen and his skin, nothing out of the usual. He has a normally, flat abdomen. It's not protuberant or anything that would give me any type of warning signs. I don't see any lesions or scarring or anything like that. vowel sounds okay. He's got normal active vowel sounds, and I'm not noticing any type of aortic pulsations that would give me any type of concern while I'm looking at him. All right, let's see. All right. Measure this. So between the two marks, it's about 9 centimeters for his liver span. Let's see. Now I'm going to assess for splenomegaly. Now I didn't notice any type of splenomegaly. Let's see here. Now, test for ascites. Let's see. That is. All right. No, I gotta do this up here. Okay. Now I need you to roll that way for me, please. Yep, lay on your side. Okay. Give it a second for the fluid to shift. So once where it was dull, it's now tympanic. Okay, you can lay back on your. So I didn't notice any type of ascites when I did the shifting test. All right, so now I need you to tell me if you have pain when I do this.
No.
No pain?
No.
Okay. Then the next one is going to be, all right, so I'm gonna need you, we're gonna flex at your hip, so you're gonna bring your leg up. Any pain?
No.
Okay. Now, we're gonna bend this, just like this, okay, and rotate your hip. Any pain?
No.
Okay. And then we're gonna raise this and bring your foot back to you. Any pain?
No.
Okay, so I had a negative SOA sign, obturator, bracing, and straight leg raise, so that does not indicate that he has any type of appendicitis going on. All right, now, my markings. Okay, take a deep breath in. Okay, let it out. Any pain? So he didn't have any type of resistance, so when I go to assess him for cholecystitis, he did not complain of any pain or any type of difficulty breathing whenever he exhaled. All right. Okay, you can go ahead. Oh, wait, no, sorry. All right. So, can you turn your neck? We've already checked the range of motion. So, I'm gonna raise your head just like this. Okay, so he does not appear to have any type of nuchal rigidity, so whenever he raises his head, you know, his legs didn't come up. All right. And then, let's see. Okay. Bend this up, and then. Okay. Any type of pain there?
No.
Okay. So when it comes to any type of nuchal rigidity or sign of meningeal inflammation, he didn't show any positive signs, so that exam would have been negative. All right, go ahead and sit up for me. tell me, close your eyes, and I need you to tell me if this is sharp or if this is dull, okay?
Dull. Sharp. Sharp. Dull.
Okay, so that was intact. Alright, now I'm going to have you close your eyes, open up your hand, tell me what this is.
Pencil.
Close enough. So he was able to distinguish what that is. Okay, I'm going to draw a number in your palm and you tell me what it is, okay?
3.
Now we're going to do the 1 point or 2 point discrimination. You tell me if you feel 2 points or 1.
2. 1. 2. 1.
See?
2. 1.
So he was able to identify the points which he needed to identify. Alright, now can you close your eyes? And whenever I'm done, I need you to point to where I touched you, okay? You open your eyes and point to where I touched you. Okay, close your eyes again. Okay, one more time. Okay, close your eyes. Tell me if it's right, left, both, okay?
Both. Left. Right.
So he was able to distinguish all of that when I tested him. Alright. Alright. You gonna tell me if I'm doing this up or down? Close your eyes.
Up. Down. Down. Up.
Tell me if you can feel this.
Yes. Yes.
Let me see your fingers, your hands.
Yes. Yes.
Okay, so he was able to sense all of that as well. Okay. Let's do your reflexes. Here. Okay, so all of his reflexes were present.